Mukhtar from Uzbekistan. I'm experienced urologist. From my professional experience, I treated many patients with erectile dysfunction. So I used many ways as a guidelines for medication therapy and external devices using like vacuum therapy and injection. But I never experienced yet implant surgery, but I have experienced other surgeries in penile, but not use it like never experienced this penile prosthesis surgery yet. It's not my case. I'm using my own money and my own time to learn these cases. Since I'm young, I have enough time to learn and improve my surgical skills and knowledge. It's, I think, perfect time to learn. I want to start treat andrological disease, especially erectile dysfunction, which is more in our country. To be honest, I have not experience in other countries implants. It's the first time I'm seeing this implants. I have only just information from internet videos. That is why maybe I don't have enough. I cannot find the differences with another countries implants. But I think this is the best one. So when I started to learn penile prosthetic surgery, I tried to find the information from internet. I find some videos from Dr. Park, and especially I saw the videos Dr. Park's with Dr. Wilson, who great urologist doctor in all of the world. Every urologist know him, and so Dr. Park has a practice several states of America, and he got a more practice, and he create his way, his surgical technique. I think it's the best way to learn from him something new way, modern way. I think this inflatable penile prosthetic surgery is the best method that I ever practiced. Inflatable penile prosthetic surgery is the best method to treat erectile dysfunctions and other external devices or injection or other methods, medications, because that takes more time, and that will give the patient uncomfort than the prosthetic surgery. That's why I think this is the best method for treating erectile dysfunction. I want to work on this field and improve this field in my country, and start my own surgical operations in my country in the near future. My goal to open my private clinic in maybe in developed countries around the 10 years. Before that, to go to study abroad, several states in United America and Europe and Asia as well. Then around the 10 years, come back to my country and open small private clinic in my country and help the patients. In my opinion, the methods who created by Dr. Park, it's not easy for surgeons maybe, but it's comfortable and easy for patients at the same time. We know Dr. Park has a more experience with Dr. Wilson, and he has enough knowledge and enough experience. He will do this. I'm quite sure his method is perfect. I want to learn this method. Local anesthesia is not only easy, it's cheaper than other general or spinal anesthesia, and it takes time, saving time, and it's easy than other anesthesia. When I saw the first time subcoronal approach, I felt it's difficult to do than subcorotal approach. But Dr. Park gave me some information about this approach. It's important for infection control and it's a beautiful plastic surgery when you will do this in a circumcision incision way. I think it's better than scrotal approach.
수술은 다 됐습니다. 네, 반갑습니다. Dr. Mukhtor came to South Korea I heard about 2 years ago to be a fellowship. He's not my fellow, but he's a fellow doing the fellowship in the other university in Chuncheon. He came over here with the only one reason why. He wanted to learn hard. He wanted to learn something better for his own people. So his enthusiasm to learning, and he's still writing a paper, and out of his pocket he had to come over to my practice to learn the new surgery. He's amazing. Dr. Mukhtor seems to be a very experienced surgeon, because after he came over to here, he was able to have a lot of cases in his fellowship university hospital. So the way he sees the things he has an eagle's eye, very sharp. He pinpoints out, why do this? Why do you do this, Dr. Park? Or why you didn't do this, Dr. Park? He asks in the right ways. Dr. Mukhtor has studied, my surgery through my video or surgical videos and my semi-live surgeries which I recorded. So he was nailing me down. He gave me very difficult questions as well. So they can tell you, I heard that he haven't done any cases, but still he was making me very difficult to answer, which means that his understanding toward the surgical process is pretty good. So I think that someday maybe I should learn from him as well. Good practice should always be based on the scientifically sound and proven ways of how to treat the patient or how we should do the practice. So without the research, and it is really hard to see how we should treat our patients in the best ways. Medicine is keep evolving. We need researchers to tell what is right or wrong. Men's sexual health isn't that, I would say, fully a completed department. Not yet. We still do not know the background of many of the physiology or the anatomical differences. We still do not know it. So to tell our patients the right thing and to give patients our right treatment, I think research is a critical point. Second reason why of the Wilson Memorial Research Center is important is for its training. I cannot treat every patient. I cannot treat all the patients in the world. Sure, for sure. And in terms of that kind of concept, Asia is compared to the US or compared to the Europe, we didn't have that much of the chances to develop our interest toward the men's health clinic. Not even men's health. We always thought about as a life or death conditions like a cancer or oncologists. Usually they had a lot of researches, but now many of our Asian countries are economically developed, just like us or the Japan or the China. We are developed now, and now they want a happy life. Now men demands a happier life. So in terms of that, they need their own physicians. They need their own surgeons who can treat them, just like I try to do in my country. That's other reason why I try to focus on the Wilson Memorial Research Center and the training purposes to make the other patients get well treated. And solidarity. The more researches we can do, the better we can help our patients. That's ultimately my goal. Because I need a comrade in this fight, I'll say. So, in this war against men's health, I'll say. So, I wish the Wilson Memorial Center will do in the coming days. Well, just like the many organizations in their first beginner stages, we strive, I'll say, try our best. Luckily, we have a lot of surgical cases. We have a lot of clinical data. So that's the reason why we are able to write more of the launch the new researches or clinical studies or other stuffs. But there's no in terms of the written paper yet. But it will come this fall and coming conferences. Actually, this coming Taiwanese Urology Association annual meeting, our research center was able to be invited for the live surgery. So I think it's in the starting role, I guess. It's pretty doing well. And other than that, in terms of the training, we try to reach out toward those more of the Asian countries or Middle Asia or Russian or Uzbekistan. Those countries we try to reach out. So the more and more the trainees are coming. Luckily, Uzbekistan doctors like enthusiast doctor like Dr. Sardor or Dr. Mukhtor came with us and they get trained. I'm so happy with that. So in my eyes, we are going in the right direction. We are not in the fully ripe stages, but I guess it's now rock and roll started. During my residency as a urologist, all the patients mainly I was seeing is life or death situations, or I would say critically ill patients, not the quality of life. They were aching because of the pain or because of the cancer or because of many things. So back in the days, I really didn't realize what quality of life care means. Luckily, I was get trained by the Dr. Wilson, and I was able to see in the U.S. those happy patients, how the surgeon can one's life happy. And throughout my training, I was surprised at how those happy patients make the happy doctors. I want my patient happy, and I want to feel happiness at the same time. That's how it became, why I am living, I'll say, happier life than before. So I want my doctor friends. I want my friends feel happy. I want my patients happy. And me myself cannot be the only one who support who make the patients happy. I want the others join this, parade as well, so that we can make it better. Because not much attention has been done toward the field I'm doing. It's not because that it is not important, but because not many of them know it. Medical technology are evolving, but where it should be focused on, I believe, and the utilitarian view, I guess, is for the better good of the society, which means that for us, better health, better, I'll say, happiness of our patients. That's why I try to be more, say more about in front of I want to emphasize more of the quality of life care.